Hello, I'm Aaron Lohr, and this is the Endocrine News Podcast. Papillary thyroid cancer is the most common type of thyroid cancer, yet in rare cases, this cancer may originate in locations other than the thyroid gland. Today, we'll be talking about causes, prevalence, and treatment for papillary thyroid cancer and the rare phenomenon known as ectopic papillary thyroid cancer. Our guest today is Dr. Nikita Deer, Chief Endocrinology Fellow at the University of Texas Health Science Center in Houston, Texas. Dr. Deer presented a fascinating case study at Endo 2025 entitled, "Where is the Papillary Thyroid Cancer?" Thank you for being here today, Dr. Deer.
Thank you for having me.
So what is papillary thyroid cancer, and what do we know about its causes and prevalence?
So like you mentioned, papillary thyroid cancer is the most common subtype of thyroid malignancy. It's actually about 80 to 85% of all thyroid cancers. And it actually arises from the follicular epithelial cells, and we classify it as a well-differentiated thyroid cancer. In regards to the causes of papillary thyroid cancer, it's pretty multifactorial, but one of the strongest established risk factors is exposure to ionizing radiation. Some other risk factors can include age, being female, or family history. Being female is actually 3 times higher incidence than being a male. In terms of prevalence, the prevalence has actually increased over the past 50 years or so, but that's likely due to increased detection from widespread use of imaging and fine needle aspiration. But despite the rising incidence, the mortality rates remain pretty low.
And how does papillary thyroid cancer usually present?
Typically, when we see patients with papillary thyroid cancer, they're coming in due to an asymptomatic thyroid nodule that was discovered incidentally either on physical exam or on an imaging study. The majority of patients do not typically have symptoms at diagnosis, but if they do, they'll have symptoms of either a palpable neck mass, or they'll have some dysphagia or globus sensation, but those symptoms are usually associated with a more advanced stage.
And can papillary thyroid cancer present in an unusual manner?
Yes, it can definitely present in an unusual manner. There have been a lot of case reports of different ways that papillary thyroid cancer has presented. It could present as distant metastatic lesions to the lung or the bone as the initial manifestation rather than showing up as a nodule in the thyroid. Sometimes it can present in a location that is not the thyroid, which we're going to talk about with my case, but there have been some case reports that have found it even in a retropharyngeal location due to unusual lymphatic spread.
How does ectopic papillary thyroid cancer usually come about?
Ectopic papillary thyroid cancer in a lymph node specifically involves a cancerous papillary thyroid cell arising from ectopic thyroid tissue within a lymph node. So during embryogenesis, thyroid tissue could be displaced due to disrupted migration. And there have been other reports of ectopic thyroid tissue being found in the kidney, the pancreas, the lungs, and the heart. And then the carcinoma could develop in the ectopic thyroid tissue rather than the thyroid itself. And the thyroid itself can be normal. But it is, like we mentioned, very rare, and it is a difficult to diagnose phenomenon.
And what is the typical treatment of papillary thyroid cancer?
The treatment options are determined by risk stratification and extent of the disease. So for most patients, they'll either get a lobectomy or a total thyroidectomy. And then based on their lymph node involvement and if there is any presence of distant metastases, radioactive iodine is considered for them. And then after everything is done, levothyroxine is used post-op for TSH suppression for the rest of their life.
Now, you presented a case at Endo 2025 that is quite interesting, and I'm hoping you can walk us through it. Can you tell us about the patient in the study and how they presented?
The case that I presented involved a 38-year-old female with no significant past medical history. She came into our clinic due to a non-tender right submandibular mass. She noticed it about 3 months prior to her visit and had noticed that it was increasing in size. She was denying any other symptoms, no weight loss, no hypo or hyperthyroid symptoms, and all of her labs were normal.
So what were your initial thoughts and what did you do?
So when someone presents with any sort of neck mass, we're wondering, is this cancer or something benign? And so our initial steps were to do some imaging. And so we ended up getting a head and neck ultrasound, and it actually showed a complex cystic structure that was 4.5 centimeters in the right side of the neck, but there was no evidence of any cervical lymphadenopathy. Once we saw that, we decided to get a CT scan of the neck to better characterize that area. And it didn't show any thyroid nodules, but it did confirm the complex right neck level 2A mass or lymph node is what the rheologist read it as, with an enhancing solid component and a thin wall cystic component. We then decided to do a dedicated thyroid ultrasound to make sure that there was nothing else going on in the thyroid, but it did not reveal any discrete thyroid nodules.
So you didn't find anything in the thyroid. You had the mass. So what did you decide to do next?
Since we had located the mass, we decided to do a fine needle aspiration. And so that was done, and it showed concerns for papillary thyroid cancer. Following that, we did an excisional biopsy, and it revealed a metastatic cystic papillary thyroid cancer on the pathology. It was 2.5 centimeters in the largest dimension, and there was no extranodal extension. They did show that 1 out of the 7 lymph nodes that were collected were positive, and it did have a positive BRAF V600E mutation.
So when did you begin to suspect ectopic papillary thyroid cancer?
So it was at this time, after we got the fine needle aspiration of the mass, that we were beginning to suspect ectopic parathyroid cancer. We, in our differential, already included primary thyroid cancer that possibly spread to this lateral lymph node versus just a primary ectopic thyroid cancer.
When and how did you get a clearer picture as to what was going on?
This biopsy really helped us identify that it was a papillary thyroid cancer. That's what we were concerned about. The next steps we actually wanted to do for this patient was thyroidectomy, because the only way to really confirm whether this is metastatic thyroid cancer versus an ectopic papillary thyroid cancer is to remove the thyroid, make sure under the microscope that it doesn't show any signs of thyroid cancer. And then we can fully confirm that this is completely ectopic in the lymph node and was not primary from the thyroid itself.
What were the next steps for the patient?
We discussed this option with the patient about doing the surgery. However, she actually was not interested in doing the thyroid surgery. She felt uncomfortable doing that, and so we have not been able to confirm that with a diagnosis looking at the thyroid under the microscope.
Given that ectopic papillary thyroid cancer is such a rare phenomenon, what do healthcare providers and patients need to know about it?
It's important to really diagnose the source with appropriate imaging and careful histopathologic and immunohistochemical analyses to determine what is the cancer that is in place and whether the source is primary versus metastatic versus ectopic, and differentiating whether it's ectopic papillary thyroid cancer from a metastatic papillary thyroid cancer is really important in determining an appropriate treatment plan and then providing the patient with an appropriate prognosis as well.
Well, I want to thank you, Dr. Deer, for coming on the podcast and sharing your case study, helping us better understand papillary thyroid cancer and when it gets unusual sometimes. So thank you so much for being on the podcast.
Thank you for having me.
That's all for this episode. I hope you enjoyed hearing from Dr. Deer about her case involving ectopic papillary thyroid cancer. I think case studies like this are intriguing, and I often wonder, should we have more of these featured on the podcast? What do you think? Do you want to hear more? Maybe something else? Let me know by emailing me at podcast@endocrine.org. We'll be back soon with another fascinating dive into the world of endocrinology. Until then, thanks for listening.
Endocrine News podcasts are a free service of the Endocrine Society. To learn more or to become a member, visit the Society's website at www.endocrine.org.